Now we are going to start with the topic of irreversible cell injury. Now starting with the mechanism, we have studied that the most common cause of cell injury is hypoxia. So when hypoxia takes place, there is significant decrease in the ATP formation. So when that happens, it affects the energy dependent calcium pumps as well present inside the cell. So when this happens, the calcium gets deposited in the mitochondria, making it obese and thus further decreasing its function. So, due to hypoxia, the mitochondria is already producing less ATP. So, when the mitochondria gets obese, it will further decrease the formation of ATP and thus, with time, will cause cell death. Now, this obese mitochondria has its densities which is getting deposited over there. So, the term also can be used as mitochondrial densities or amorphous densities, which can also be given in the exam. So, now the extra calcium causes enzyme activation like nucleases, phospholipase, lysosomal enzymes, which eventually leads to cell death as well. Because we know now if phospholipase is secreted, the cell membrane is also composed of phospholipids, right? So thus a phospholipase destroys the cell membrane. For example, if we take the example of cardiac cell, if there is cell injury in the cardiac cell, there can be two types of cell injury, right? One can be reversible and the other can be irreversible. So if there is reversible cell injury, the cell just becomes bigger and no membrane is damaged and the enzyme won't leak out. The enzyme over here I'm talking about is obviously troponin. So this is the normal case when the patient comes and complains of chest pain that we can normally consider as angina. So that will be a simple example of reversible cell injury. Now if the cell injury persists for a long time, it can eventually lead to irreversible cell injury. So if we do an ECG, we can find that obviously the person has undergone myocardial infarction. So if there is myocardial infarction, the enzyme troponin will obviously leak out, and we can also do a blood test to find this out, because in the blood the level of troponin will significantly increase. Now the activation of nuclease enzyme leads to pycnosis, which leads to karyorrhexis and then karyolysis. This is three-step process by how the nucleic material gets dissolved. Now causes of cell death has mainly three types. The main two types are being necrosis and apoptosis, and the third type is necroptosis. Now starting with necrosis, there are various kinds of necrosis that I'm going to explain over here. So the first one I'm going to start with is coagulative necrosis. Now coagulative necrosis is the most common subtype of necrosis. So in the exam, if it comes like which is the most common necrosis seen, we can obviously mark the option as coagulative necrosis. So the important points which we need to remember regarding coagulative necrosis, we have studied previously that most common cause of cell injury is hypoxia, and most common cause of hypoxia is ischemia. Thus most common cause of coagulative necrosis is ischemia in solid organs. That's the point we need to remember. And the second point which we need to remember, that it can be seen in all organs except the central nervous system. Now what can be seen in the central nervous system or the brain? Now that part we come into liquefactive necrosis. In liquefactive necrosis, there is release of hydrolytic enzymes which thus damages the tissue, forming pus. It can be seen in the central nervous system, and if any infection is present, it can also be seen at that point of time. Now here I want to make a link with microbiome, where we can say that the pus formation which we can see is associated by the bacteria which is Staph aureus. This we need to remember. It is a very important paper 1 question. And we also need to remember that the Staph aureus is catalase positive. And this we can say that there is abscess formation. So if the question comes as if there is abscess formation found in liquefactive necrosis, which bacteria can be identified, that will be Staph aureus. Now coming to the third type of necrosis, which is fat necrosis or fatty necrosis. Now the important points we need to remember that during acute pancreatitis, we can see the activation of enzyme lipase. So when the lipase enzyme is activated, it triggers the formation of fatty acids. Now the fatty acids has an affinity for calcium, so together they create a yellow chalk-like deposits. So this is the process which is termed as saponification. So what is saponification? Saponification is the process by which fatty acid and calcium combine together to form a yellow chalk-like deposit. Now coming to the fourth type of necrosis, we have caseous necrosis. Caseous necrosis is just a cheese-like necrotic material. When tuberculosis happens, we can see caseous necrosis over there. Caseous necrosis is nothing but coagulative necrosis along with liquefactive necrosis happening together. So the next type of necrosis we come into is fibrinoid necrosis. When there is damage to endothelial cells, the plasma protein enters the wall of the vessels, and thus we can see deposition of pinkish materials. So during fibrinoid necrosis, there are some conditions which are associated, which are as follows. The first one is malignant hypertension. The second point which you need to remember is Aschoff bodies. Now Aschoff bodies are commonly seen in rheumatic heart disease or person who has undergone rheumatic fever. So you can find Aschoff body over there. And the third type is hypersensitivity reaction, and the reaction type is 3. So type 3 hypersensitive reaction, which is an immunocomplex disease. Also along with polyarthritis nodosa and post-streptococcal glomerulonephritis. So these are the conditions associated with fibrinoid necrosis, or where fibrinoid necrosis can be seen. And the last type I want to discuss about is the gangrene. Now there are two types of gangrene generally. One is dry gangrene, which is due to ischemic damage and which is under coagulative necrosis. And the other type is wet gangrene, which is ischemia along with secondary infection. Now if there is infection, we obviously know that fluidic necrosis will be involved, so there will be liquefactive necrosis as well. And if there is a question, if it comes like diabetic foot is associated with which necrosis, you obviously mark the option as wet gangrene. Now there is a subtype I want to discuss, which is that sometimes there is an infection during a trauma where the dust particle enters the wound. Now this infection is done by a bacteria called Clostridium perfringens, which causes the production of gas. Now this is the part where we call the term as gas gangrene. Now the important points to remember at last are going to be as follows. So as we studied, the cation responsible for the cell death is going to be calcium. Second point, the irreversible change will be cell membrane damage. Third point will be indication of myocardial infarction is troponin level increases in blood. Fourth point, commonest necrosis and cause is coagulative due to ischemia. Coagulative is the commonest necrosis and its commonest cause is ischemia. Pus formation associated with which bacteria which is going to be Staph aureus. Bacteria found in abscess formation is going to be Staph aureus as well. Fatty acid plus calcium undergoes a process which is known as saponification, right? Aschoff body is found in which disease? Rheumatic heart disease. Type 3 hypersensitive reaction, immunocomplex disease is related to which necrosis? Which is fibrinoid necrosis. Clostridium perfringens is associated with which necrosis? Which is going to be gas gangrene. Diabetic foot is going to be associated with which necrosis? Is going to be wet gangrene.